Thank you for listening to Depictions Media Radio.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my left is Premier John Horgan. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer, and the lead of our BC Immunization team, Dr. Penny Ballum. And we're honored, all of us are honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Today, you're going to be hearing a presentation from the Premier and then presentations with the deck from first Dr. Henry and then Dr. Ballum. There's going to be a lot of information on our acceleration of our vaccination program in British Columbia. Our regular report on case counts and other COVID-19 issues will be coming in written form at 3 o'clock. And so you'll get that information there, but this is an extremely full session, and we want
days and weeks in my head, but until that happens, each and every one of us has an obligation to our neighbors, to our communities, to make sure that we're following those guidelines. I'm very excited about the news that Dr. Ballum and Dr. Henry are going to be sharing with us today. This means we're closer to the end. But again, vigilance needs to be the order of the day. British Columbians have done such a spectacular job to this point in time. Let's not let each other down now. Thank you very much.
Thank you and good afternoon. So I am very pleased to be able to talk today about where we're going forward in our program using the AstraZeneca COVID vaccines that we have now in British Columbia. As you know, we had said from the very beginning that once we had a fridge-stable vaccine that would allow us the flexibility to use in more places around the province, we would be targeted at frontline workers and workers in specific at-risk workplaces and industries. We now have 2 vaccines that have been approved by for use by Health Canada, one of which we've had in the province, and that's the AstraZeneca or Covishield, which is the Serum Institute of India version of the same vaccine. It's approved by Health Canada and now by NACI for use in adults over the age of 18. And our BC Immunization Committee has been tasked with providing us with the best advice of where we can make the most difference and how to start the use of this vaccine. Registry on a daily basis. This is critical for all of us, and it is something we have focused on from the very beginning, making sure that every dose, every lot number that everybody receives is in our provincial registry, not only so that you have a record of what vaccine you received and when, but it's an important part of our safety monitoring. So we monitor that information by lot number, by every vaccine on an ongoing and daily basis so that we're able to see if signals arise. And we know this is the same process that's happening around the world. We share information, and we've heard about some of the concerns expressed with vaccines in Europe, and it was a safety signal from this type of monitoring that allowed them to take a pause and look and assess those debates. Get housing is in the part 1 of this program. Correctional facility staff, again, some of the staff have been addressed because we've had ongoing outbreaks in our provincial correctional services and federal correctional facilities, and the inmates in the federal correctional facilities are covered under the federal program, but both federal and provincial staff will be covered under this program. As well, we're looking at cross-border transport, and we're working with the Ministry of Transportation and Infrastructure to identify exactly who the groups are at risk in these communities. Smaller groups of people, including our quarantine officers and bylaw officers. We'll be looking at postal workers, as we know that is also an environment where we're seeing ongoing outbreaks. And many of us, of course, are dependent on the packages that get sent around the country these days. And finally, grocery store workers. And we'll be defining those more clearly for people as we work through this. There'll be hopefully some as well that we can use to continue to target those outbreaks that we're seeing now. So this is approximately 320,000 workers identified in these target groups. Some will already have been started to be immunized in this part 1 that we're doing right now, and we've been working on the scenario of about an 80% uptake. As I mentioned, this is a fridge-stable vaccine, so that means we can use the infrastructure that we have in our community, and particularly our community providers, pharmacies specifically, and we've been working with the pharmacy associations to make sure that we can do this in an efficient way, and we know that there are many pharmacies and pharmacists who have been part of our influenza immunization program that are ready and able to take this up. About 60%, as you can see from our targeted groups, are people who can be identified through their identification related to their work. And then we'll be focusing the remainder of the activities on the 40% where we will be doing health authority-driven clinics on site, some of which have started already. So this allows us to really move ahead with our large shipment of this vaccine to target these groups of people who we know are essential for keeping our communities going. I mentioned some have been addressed starting
in our community and so on. And we continue to work across the province with the First Nations Health Authority. I'm really happy to report that we're, well underway to finish off by the end of March physicians and then make their appointment days. So just looking at the math, it's about to get vaccinated regardless of their age. So between those two groups, we will cover off the extra 500,000 doses of Pfizer that are coming to us. When we look at the feasibility for the different health authorities to actually ramp up this activity, I would say in the Lower Mainland, both Vancouver Coastal and Fraser have more large clinics. It's a bit easier and it will be faster for them to expedite opening up more capacity. And in the interior, the north and Vancouver Island, particularly in the northern part of Vancouver Island, they'll be working hard with us to ramp up their activity, probably a bit more back-end loaded toward the middle of April. So we're very confident that we are going to be able to use this vaccine in a very timely, expedited way to move up our population protection. So, this slide just very simply walks you through the numbers of the different groups and shows you that at the end of it all, we have about 44,000 doses of vaccine that we will either have used up because we get more than 80% uptake, which is about our average, or we'll bring on capacity. And in May, we'll be at a minimum, pending new news about new vaccine arriving, people aged 59 down to 40, and in June we'll get our younger group vaccinated. And this is remarkable progress if you think back to January when we were talking about September to get this done. Now we will have second doses, and that will happen in a structured way consistent with the evidence, as Dr. Henry has indicated. And in the meantime, you can see in the yellow across the bottom of this slide that we'll have all of these different worker groups in the AstraZeneca Covishield program who will also contribute to the protection of our population. So in summary, as of March 12th, we're looking at a bounty of vaccine, which is, a remarkable opportunity. We are working very hard to respond to that and move up our population, accelerate their vaccination and their protection. This is a real benefit, particularly in the Lower Mainland, where we have an outbreak that is particularly difficult, and so it helps all of these things. It helps us manage our pandemic, protect our hospitals, and advance the protection of our population. And by our calculation, just with the Pfizer and Moderna, without considering the impact of AstraZeneca, we will have about a quarter of our population vaccinated by the end of next month. So the additional coverage by AstraZeneca will contribute to this, but essentially it's good news for our public. Very happy to be here, announcing this, and there will be more to come.
being adhered to. It's a very challenging job, and what we have found is that some settings, it just makes it that much more difficult. Partly it's volume of people, but it's also the type of work that they're doing, and I bring up poultry plants because we've seen that repeatedly, that even with the best laid plans, with having in barriers, it is very challenging in that environment to maintain the use of the PPE on an ongoing basis. So we have very strategically targeted those places, those types of environments where we're seeing that difficulty despite people's best efforts. So it is a combination of those things, and you know it is what it is. There's some industries, there's some work sites where it's much more difficult. Yes.
I just want to note, it has been, I think, for everybody in BC, extraordinarily moving to see the immunization that's taken place in Prince Rupert. But it reminds us that COVID-19 is a vicious enemy, that the people of Prince Rupert, the exact same people who were living there last year when we had virtually no cases in that community, it had the lowest rate of transmission. Now we're facing significant transmission. And they are struggling with that. So these tools have been used by public health to respond to this. This is true in workplaces. We've done it in every part of BC, and now we can do it more because there's more vaccine available. But I think it's really important. Of course, we need to have COVID safety plans that people follow. But it's also important to understand that sometimes, and we saw this in the case of the trivia night, sometimes it impacts other workplaces in ways that are very difficult to control. All I can say is we need to have absolute compassion for people who have suffered from COVID-19 in this pandemic. And everyone who has not, like myself, not have been diagnosed positive with COVID-19 should be thankful for that and be supportive of that who are struggling with it. So this is not about blame. This is about an effective public health response with the situation in Prince Rupert and other.
Or how are you getting people? Are you hiring them? Are different people volunteering? Can you just talk a little bit about sort of how to get there?
Sure, I'll start, and then Dr. Ballin can talk about some of the partnerships. But as you know, we issued a PHO order that allows a whole variety of allied healthcare professionals and retired healthcare workers to come back and work in a supervised position as immunizers. Some will be volunteers, physicians, pharmacists, nurses who are doing immunization on an ongoing basis in our health authorities and private organizations. And others will be paid to be immunizers, but we have many other positions that are needed to run a clinic, and Dr. Ballin can talk to that because we've had some great partnerships.
Yes, so we're very fortunate, and
Those people.
Our K-12 system, we know who our child care workers are, for example. So we will be reaching out to you. It'll be a combination through the health authorities, and it will roll out and as the health authorities are able to organize that with local providers and with health authority-based clinics. And we're doing it based on risk in many areas. So we will be looking at targeting, for example, we know where some of the hotspots are in the Lower Mainland. Some communities are having more challenges than others. So that will be all done through partnerships with the health authorities. So we will be reaching out to you, and it is, for the most part, it'll start early in April. So over the next few weeks, we'll be reaching out and coming up with a plan across the province for addressing each of these areas.
Richard, do you have a follow-up?
I do. Let me ask about the variants of concern. So we've seen this increase in variants. How much could that disrupt what we are seeing in terms of a potential easing of restrictions? And when you balance the priorities around the easing, what sort of numbers in terms of both variants and cases are you looking at?
Yeah, so the variants and the cases are the same, right? So the variants are a subset of the number of people every day that we see, or over the 7-day, the rolling average. But they're detected retrospectively, though we're catching up now because we have this marker test that we do for every positive. So the cases that we've identified that are people who have the variant of concern, and right now the one that we are seeing in BC that is taking over, if you will, same across the country, is the B117. So we are seeing increasing proportion of our cases every day being the B117. So it's not in addition to the cases we're seeing, it's the subset. So the proportion of the cases that we're seeing is now around somewhere between 10 to 12% of our cases every day are now this UK variant. We are still seeing very small numbers of the South African, just sort of sporadic, mostly related to travel. And we've had one cluster of this Brazilian variant that is concerning, but we're managing it very carefully with Vancouver Coastal. So this is a discussion that we've had, of course, around the world, but we had another discussion this morning. You know, what is the impact? What are we seeing? And what we are learning is that some of what the increased transmissibility means is related to what phase you are in a wave or in the timing of the year. So the fact that we're not seeing rapid takeoff with the number of variants. So it's not like they're adding on to the cases we're seeing. What we're seeing is of the cases, they're being slowly replaced by this variant being more common in transmission. So that is, in one sense, it's a good thing that it's the B117. What we're learning, and again, this is science in action, we're learning, and this is something that we have been working out just in the last few days, through some of the modeling, looking at what happened in other countries, is that that one variant tends to replace what other strains you're seeing. And for us, that it seems to be in Canada, the B117, at least here in BC, and Ontario and Quebec, they're seeing the same thing, Saskatchewan. And in a sense, that's a good thing, because that one we know the vaccines are still relatively very effective against, where some of the other, particularly the Brazilian variant, there's concern that vaccines don't work as well. But, you know, things can change. So what we are watching very carefully is, are we seeing things, the variant drive transmission, or are we just seeing it replace the viruses that were circulating previously? And what we've learned over these last couple of weeks is that it's mostly replacement. But that's not to say that that's not going to change if we're not careful, because we do know we have to be more meticulous about preventing transmission, because this one tends to be easier for somebody to spread it to others. So what that can mean is that we'll have to be more cautious for longer if our rates stay as high as they are, and making sure that we get more people protected as quickly as possible and try and break those chains of transmission. So this is all of our challenge right now. At 500 cases a day, with this more transmissible virus replacing a lot of the viruses that were the other ones, we have a smaller margin of error for our individual actions to prevent transmission and our group actions that prevent transmission. So that's our COVID safety plans, that's our making sure our numbers that we get together with are small, that we do things outdoors rather than indoors, so we're not risking that rapid transmission to people. So time will tell, but that's what we're seeing right now.
Next question is from Rob Buffin, CTV BI. Rob, are you there?
Hello?
Yep, go ahead.
Oh, hi. Thanks for taking my question. I guess what I'm wondering is, Dr. Henry, if you're able to sort of elaborate on where we might be at in terms of easing restrictions. You said earlier that by the summer, which would be sort of June 21st, we could expect some restrictions to be eased. Yet you also mentioned that by the end of the summer or the fall is when we could get back to local type gatherings. So, you know, presumably by the end of June or June 21st, pretty much everyone will have had one shot. So between then and the end of summer, what type of activities could we expect to get back to?
Yeah, I know. I wish I could tell you. Unfortunately, I can just give you a sense of what could happen. What I would like to see, of course, is that our transmission drops off, that we have no more clusters and outbreaks, and 3 weeks after all of the younger people that we have in our lives are immunized, we're able to go back to lots of things. I just don't know that yet, and we're all in this same conundrum across the country. We were talking about it this morning with my colleagues across the country. What things can we do first? What things make the most difference? And I will tell you the principles that we're thinking through. One is that the more people that get together indoors, the greater the risk, regardless. And we've learned that. We learned that if you're indoors with lots of people, and it depends on what you're doing indoors. If you're sitting with a small group of people and there's barriers and there's other small group of people and you're not mixing, think of a restaurant, then the risk is less. If you're a larger group of people who are interacting with each other and moving between groups, the risk goes up. So, and numbers make a big difference. And it's not only the numbers, if you have 25 people, the probability that one person has this virus and might spread it to others is less than if you have 50 people. But the other side of it, from our perspective in public health, is we've learned that contact tracing, making sure we can find people quickly and stop that next generation of transmission, is also important in managing the pandemic. So that's why we had, for the longest period of time, a number of 50, because with safety plans in place, with the risk that we had in our community, the risk that somebody might actually have the virus in a group of 50 was pretty low for a long time, and the fact that we could find them and stop ongoing transmission because with our public health resources was pretty high. And then that balance got tipped over in late October into November when we saw this very rapid increase. And, we were, all of my public health colleagues, watching things very carefully. And it really was almost over a period of a weekend that we saw such a dramatic increase. So we learned from that, and at that point, because our public health resources were getting stretched, we had to stop those indoor gatherings of any size because the COVID safety plans that we had in place weren't working anymore. The probability that somebody, even in a group of 10, was carrying the virus went up, and our ability to find them, because we were dealing with so many cases, had gone down. We're now at a point where we're getting back into a balance. We can follow up on every case. We can find people. We've been having small groups only, so that needs to continue so that we can keep that balance and keep our schools open and keep our hospitals from being overwhelmed and keep our surgical renewal going and keep as many workplaces as we can going. So that's the place we're in now. As we get more people protected and as we try, hopefully, to get transmission rates down, which means the probability that any one person will have the virus goes down, we'll be able to have larger groups again. But it'll be in a slow and phased approach so that we're safe in how we're doing it. So that's kind of a long answer, but it is to say those are the things we're thinking about as we move into summer. So how can we do safe graduation? How can we have small, safe gatherings over the summer period? I think I hope and expect we'll be able to get back to similar to what we had in the fall with the groups of 50, and then looking at expanding from there. The things that I think, on the other hand, we're not going to see this year are large international travel. So groups that bring people from many other countries to BC for an event, whether it's a conference or a meeting or a wedding or a family gathering, those things will be dangerous because we know that a vaccine is not available equally to countries around the world. And we've said this from the beginning, the risk anywhere is a risk everywhere. So we're not immune to that. So things like international travel, international gatherings, large festivals that have people coming from multiple places are not likely to happen this year. And things like cruise ships coming into BC are not going to happen this year either.
Rob, do you have a follow-up?
I do, and it's a question for the Premier on behalf of a colleague of mine. Premier, we've heard from a growing number of people with concerns about their treatment in relation to psychiatric treatment, specifically 2 young women who were independently experiencing a mental health crisis and went for help for that at Royal Jubilee. And they've alleged that they were treated in a dismissive way. I gather they've met with you and expressed their concerns. I'm just wondering what your reaction is, specifically in the context of those 2 women, and what's going to be done about it moving forward.
I did meet with Emma and Ella last week. Their situation had been brought to my attention in the legislature. 2 young women who had accessed mental health services as youth and were comfortable and felt that the outcomes were positive for them. And then they transitioned into adulthood and were unable to access the care they'd had before and were put into an adult setting, and their response was quite different from that. I had the honor to talk with both of them and the minister responsible, Sheila Malcolmson. We listened intently to their point, which was why the difference between being a youth and being an adult. I know that Sheila will take that information away, and she's working with Vancouver Island Health Authority with respect to the delivery of mental health services at the Royal Jubilee versus what youth are able to access at Victoria General. But it was a compelling story and one that was quite moving. We're hopeful that that story can lead to changes, positive changes, so that it's not repeated in the future. But the challenge, the most interesting part of the engagement was both Emma and Ella did exactly what we've asked them to do. We don't want to stigmatize mental health challenges. We want to be open and talk about it. Certain media outlets have a campaign that's saying, let's talk about it. The Vancouver Canucks have an aggressive campaign to destigmatize mental health issues, as do we as a government. These 2 young women followed what they thought were the right course, and they didn't get a positive outcome. We need to make sure we do a better job of it, and had we not had the opportunity to speak with these 2 women, we wouldn't be in the position to make the changes they want to see.
We have time for one more question today, and that comes from Tanya Fletcher, CBC.
Hi there. Dr. Henry, when it comes to the second round of AstraZeneca, is the priority order as per the slides presented today? This is kind of a follow to Richard's question earlier. As in, will you start with first responders, then school staff, and work your way down the list as we see it in the presentation, or will these groups all be vaccinated simultaneously at the same time?
Yeah, so they're not in rank order. It will be some combination of parallel streams as we work out how best to do it for each of the different groups, and particularly for some of the industry groups, we'll have to do it in a phased way over time. So yes, it's not a rank order in any way. We're going to be trying to address as quickly as possible all of the groups as vaccine becomes available.
Tanya, do you have a follow-up?
Yeah, thank you. You mentioned that rules about visits in long-term care homes are still being reviewed, but we have information from a long-term care home operator in Vancouver Coastal Health that outlines some pretty specific changes to the current rules. Can you explain why those changes haven't been approved yet, or when they'll be approved, or will they apply in certain health authorities and not others, or is there some individual discretion here between health authorities that can kind of ease their own restrictions?
So no, there is a provincial standard for that, and it's under a provincial order around visitor restrictions. I know that some of the health authorities have been updating because there were new provisions. We had some discussions about this a few weeks ago from the Office of the Ombudsperson to make sure that it was very clear what the process was for appeal if somebody was denied either a designated visitor or a essential visitor status. And I know that some of the health authorities have updated their guidance to make sure that those processes were much more clear. And I believe that's what you're referring to, but I know the minister has some comments too.
I think it's exactly that, and these were changes. Some of them were updating, and some of them were changes in the way the orders were made by Dr. Henry a few weeks ago. So I think that's reflected in the Vancouver Coastal Health document, as I understand, as I've reviewed it. And but just to note on the key question of visitation, which is important for everyone, I think Dr. Henry has made this point. We're going to be making changes in this month of March. It's now March 18th, so that means soon, either next week or at the latest by March 29th, to the general rules around visitation in long-term care, given the success of our vaccination program. So you should expect that very soon, working with all the health authorities, and we'll be working over the next short period with providers in long-term care on those changes. So those are coming. We have made changes all along about issues around essential visitors, and I believe the documents you have reflect that, things that were announced and were put in provincial health orders a few weeks ago. Je dirais en français qu'on va faire des changements pour la visitation dans les centres de soins au long terme. Ces changements sont nécessaires, bien entendu, après un an de difficultés pour des gens pour vivre normalement dans ces maisons, chez eux, comme un groupe dans la société. Donc, il va falloir des changements. La vaccination nous a donné cette opportunité, ce qui est extraordinaire. Et ça va être une véritable célébration. Et on travaille à fond actuellement pour faire ces changements, et on va avoir quelque chose à annoncer pour tout le monde d'ici la fin du mars. Merci beaucoup. Thank you very much.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.